Hi, I'm Marty Jolly, Director of Nursing from DakotAbilities. I'm going to take the time to teach you about catheter care, how to replace a catheter for the people that we support as one of their nurses. First thing you want to do is you want to make sure that you get your supplies ready, that you're cleansing whatever tabletop you're going to put your supplies on. I've already cleansed my area, and then I'm gathering my supplies. What I'm going to need to replace that catheter is that person's ordered replacement catheter. So whatever the correct size of the tube and length of the tube and type, I need to make sure that I have on hand based on that person. The next thing I need to have is a syringe to release the fluid from the balloon in the catheter that's currently inserted. I'm going to need to have my insertion kit, and then I'm going to need to have a new catheter bag. I always want to replace my catheter bag whenever I'm replacing a catheter for a person. We want to start by letting the person know what we're about to do. Okay, Gina, we're going to go ahead and replace your catheter now. I'm going to remove the old one and then put in the new one that's ordered from the physician, okay? Now I want to only uncover the part of the body that I'm going to need to be uncovered for this process so that I can keep the person warm, or as warm as possible, while we do this procedure. I'm going to go ahead and pull the blankets back so that I have full access to that area that I need to see. I'm going to cleanse my hands. If you have a sink, you'd want to use a sink and warm water. Right now I don't, so I'm using hand sanitizer instead. So I'm going to get a generous dollop of that, and I'm going to rub that all over my hands until it's completely dry. Once it's dry, I'm going to put on my gloves. So before I do anything with the catheter, make sure that I've got my gloves on. Now, at this point, I like to remove the fluid from the balloon that's currently in the person. So I'm going to go ahead, connect my syringe to the balloon port on the catheter, and I'm going to pull all that fluid out of there. Once I've got it all out of there, I'm just going to release it and set that aside. I'm not going to pull the catheter out at this point because I want urine to still be draining into the bag until I'm ready to replace the catheter, but it will be an easy removal once I'm ready. I'm going to go ahead and cleanse my hands with hand sanitizer because I don't have access to a sink right now. I'm going to rub that in vigorously until it's completely dry. Once it's dried, I'm ready to go ahead and put on my sterile gloves. Sterile gloves, I'm going to grab onto the inside of the glove. I'll be placing that onto my hand. Now I'm going to reach in with the sterile part to the other. Place the glove, got my sterile drape. And place this over my site. I'm going to go ahead and take the iodine packet, and I can open that. Mine has the iodine swab sticks. And open the lubrication, and I can pour that into the bottom of my container. Go ahead and open the syringe for my balloon. Go ahead and grab the catheter, place it into the lubrication at this point. Get the end of the tube lubed up. All right, I'm going to go ahead and cleanse the area with my iodine swab. I'm going to go ahead and clean the inside, the folds, working my way further out as I go, always working away from the opening to avoid pulling bacteria toward the opening. So at this point, I've maintained sterility. Now one of my hands is going to become dirty so that I can remove the old catheter, and then I'm going to place the new catheter. Okay, so it's just important to keep in mind which hand is which and keep those the way that they need to be. So I'm going to go ahead and grab the new catheter with my remaining sterile hand, and I like to kind of bunch the tubing up in my hand to make it easier to place the catheter. So I'm just getting it bunched up in my hand to make insertion as easy as possible. And I can kind of keep moving it down as I need to for that. This is going to become my dirty hand. I'm going to go ahead, pull the old tube out. Remember, we had already taken care of that. Going to place the new catheter into the site. And now what I want to do is fill the balloon. So now I'm going to go ahead and connect to the catheter bag. Once I've got that connected, the procedure is done and everything should drain appropriately. Let's talk now about removing and inserting a suprapubic catheter. Some of the people we support who are going to have catheters long term or for the rest of their lives, they're going to switch to a suprapubic rather than a urethral catheter. The reason is it's more comfortable and there tend to be less issues than with your standard urethral catheter. First thing we want to do is let the person know what we're going to be doing. Okay, Gina, I'm going to go ahead and remove your suprapubic catheter and replace it with a new one. I'm going to uncover to the area that I need to see for the replacement. At this time, I'm going to go ahead and do my hand hygiene. If you have a sink, you're going to want to wash with warm water and soap for 20 seconds. I don't have a sink right now, so I'm going to go ahead and get a generous dollop of hand sanitizer, and I'm going to rub that in until it's completely dry and my hands are ready to go into my gloves. So vigorously rubbing all over. My hands are clean. I'm going to go ahead and place on my gloves now. Before I touch the catheter, I want to make sure that I have my gloves on, okay? At this time, I prefer to take my syringe and remove the water from the balloon on the old catheter. That way I don't have to worry about doing that later. I'm not going to be tugging on the catheter, so I'm not going to tug it out of position. So I'm just pulling back until I get all the fluid into the syringe that was in the balloon. Once I've got all the fluid in the syringe, I go ahead and twist, release, and I'm done with that syringe. I'm just going to leave the catheter there, and I'm going to step over to my field. I've cleansed my table. I'm going to go ahead and get my supplies ready to change the catheter. I've got my catheter replacement kit. I've got the new catheter that is the French and the size and the type that the physician has ordered for this person, and I know exactly how many cc's of fluid I need to put into the new balloon once I fill it. I've verified all of that on the person's MAR to check what the doctor's orders are before I go forward with this process. Go ahead and open that up, and the new catheter bag is always going to come with a cap on the end of that tubing. So I'll leave that sitting right here for now. Next, I can open up my sterile container that has my supplies for the catheterization. I can open up my catheter so it's ready to go. I'm going to go ahead and take the drape for my field out. And lay that down. Take off these gloves. I'm going to go ahead and perform hand hygiene again. Vigorously rubbing the hand sanitizer into my hands until they're dry. So I've hand sanitized. I'm going to go ahead and put my sterile gloves on now. Grabbing the inside of the glove and placing it on. Now I'm going to grab with the outside, the sterile part, with the other hand. Pull that down. I can grab the rest of my supplies and move them over to my sterile field here. And I'm going to go ahead and open my iodine wipes so that they're ready to use. Can take the tip off the syringe so it's ready to go. I'm going to go ahead and cleanse the site now. Take one of the iodine prep sticks, and I want to go closest to the site to the opening first. So I'm just going all the way around the site with my first iodine stick. Further out, my last iodine stick, I'm going to go ahead and get the catheter and place it into the lubricant, rubbing it back and forth through that. And then I kind of ball up the catheter in my hand, and I'm going to go ahead, this is going to be my dirty hand, remove the old catheter now and place the new one. What I like to do with the suprapubic catheter that's different than a general catheter is I'm going to put my fingers right up next to the site, and I can pull it out and see that this is how much was inside the body. Or if I pull it out and this is how much was inside the body, I can match that up to my hand here without them touching. I know I have to put in at least this much to get it into the right position. Once I've got it into the right position, now I can go ahead and I can take my syringe and I can fill my balloon with the recommended cc's of water. So I'm just going to fill that up with the number of cc's I need. And then I can give it a tug and I can see that it's tight and it's ready to go. Last thing I'm going to do is connect the bag to the catheter. So I'm just going to go ahead and put that together, and I'm kind of using a twisting motion to get that sealed on there correctly. And once we're sealed on there, good to go. Got my cleanup done, and we're good to go. Thank you so much.